moving on from the adult diabetic emergency protocol to the pediatric one. The first one we're going to go to is the hypoglycemia part. So it's pretty similar to the adult one. However, dextrose doses are a little bit different. So at EMTs, same thing for you guys, routine patient care, obtain a glucose reading. If the patient can swallow and hypoglycemia is present, administer oral glucose and consider an ALS intercept. Advanced EMTs, IV access and administer fluids to maintain hemodynamic status, so their blood pressure. For any age, you can administer D10 at a 5 milliliters per kilogram bolus up to 25 grams. Reassess the mental status and blood glucose after half of the dose, and if improved and glucose greater than 80, you can hold the remainder. If the patient is less than 30 days old, administer dextrose 0.25 grams per kilogram IV push of D10 or D25. Highly recommend going with D10. If you do the D25, you may have to dilute the D50 because I don't recall if we carry the D20 pre-filled D25 syringes. I'm pretty sure we don't, so you would have to dilute the D50 if you did want to do D25. So I recommend going with the D10. And then ages greater than 30 days but less than 2 years, administer dextrose 0.25 grams per kilogram IV push, and if you do D25, it's diluted 1 to 1. And then 2 years or more, you can give D52 at 0.25 grams per kilogram IV push. Again, I think it's easier just to do the D10 because it's applicable across all ages. It's less necrotic and just a little bit better for your patient, I feel like. So just keep that in mind when you're deciding. And again, same as with the adults, we don't carry glucagon here, so we'll just kind of skip over that. This is the pediatric hyperglycemia protocol. EMTs, you guys doing routine patient care, making sure you get a glucose reading. Consider ALS intercept if they have abnormal vital signs or an altered level of consciousness. And the biggest change to this part of the protocol is making sure you obtain and document an end-tidal CO2. Again, all certification levels from EMT up can obtain and document an end-tidal CO2 reading. Advanced EMTs, IV access, administer saline to maintain their systolic blood pressure, maintain a patent airway, adequate ventilations and transport. Paramedics, you're going to do airway management as needed. And if you suspect DKA, so hyperglycemia with rapid breathing and a low end-tidal CO2, administer IV normal saline or LR at a 20 milliliter per kilogram bolus in an attempt to dilute the blood sugar. Now that's only paramedics, not advanced EMTs. So just keep that in mind, everybody.